My name is Greta Waitz, and this is the case assessment for Sergio and Richard. So, basically, Sergio and Richard both have strengths as well as needs. Sergio's strengths are his family values, his hard work, and his passion for education, as well as his religion, which is Catholicism. Richard's strengths are his familial values, his progressiveness, so his unwillingness to raise his children in Catholicism and in conservatism, and his setting boundaries. So basically, just communicating with Sergio that he doesn't want to raise his kids in such a position. Sergio's needs are his immigration and lawyer resources. So basically, anything that will help him with his immigration process. He needs some relationship counseling. I believe there are some attachment issues there, and I think that partnership counseling would be beneficial. Adoptions and advocacy resources. So since they've adopted children and since they're wanting to adopt more children, I think that these resources would be really beneficial to them, as well as mental health counseling for Sergio. I think that it would really benefit him as well as some of his mental health needs. For Richard, I think that he as well needs relationship counseling. I think that he also needs some career and job resources. I think that he's really struggling to find a job, and that a little bit of an potentially an employment agency would be really beneficial, as well as substance use treatment. I think that finding a little bit of treatment for his alcoholism would be really beneficial as well. So suggestions for diagnoses for Sergio, I think a little bit of depression, maybe some attachment disorder, specifically maybe anxious attachment disorder, and then I think maybe a little bit of PTSD relating to his process through immigration. So his influences on development for Sergio and Richard. Their ethnic influence for Sergio is that he was raised in Brazil. The social influence are going to be his issues with immigration services. And then his cultural influence are going to be his religious views, Catholicism, and his Brazilian traditions and values, and cultural traditions and values. For Richard, his ethnic influence is going to be marriage to an undocumented immigrant. His social influence is inferred past experience with homophobia, and his cultural influence is his religious views, which are Judaism to atheism. Potential biases and ethical considerations. Immigration and people of color. So Sergio is an immigrant and a Hispanic individual. Especially undocumented immigrants. He is not presently documented, but married to a United States citizen. Anti-Semitism and anti-clericalism, so they're both suffering from different types of anti-religious beliefs. So anti-Semitism being for Richard, who was Jewish, and then anti-clericalism for Sergio, who is Catholic. And then same-sex and queer relationships and same-sex and queer parenthood. So they are both, I'm sure, struggling with the United States societal expectations of the LGBTQ community, especially in today's times. So related theories. My first theory is going to be the systems theory. I believe that individuals are products of their surrounding complex systems. So for Sergio, this is going to be their closest with his direct family, so his mother, father, siblings, and then also his husband and his children. And then the dynamic between intimate and parental relationships. So basically, Sergio's relationship between his husband and between his parents. Theory 2 is going to be the attachment theory. I believe that Sergio has some anxious attachment issues to Richard, or with Richard. So infant and caregiver relationship affects later relationships. Sergio's closest with his family causes attachment disorder in his current relationship. I believe that his closest with his family may have caused some attachment issues in his intimate relationships. I really do believe that Sergio maybe has anxious preoccupied attachment disorder, and dismissive attachment disorder. So recommended evidence-based practices. I believe that motivational interviewing, so motivating and providing the skills to work through relationship issues independently. I believe that helping Richard and Sergio to process their thoughts and challenge them, and to identify healthy coping mechanisms and healthy coping communication skills will really benefit both of them. Cognitive behavioral therapy. I think that identifying, challenging, and replacing their thoughts, their negative thoughts, especially Sergio's negative thoughts towards, or Sergio's thinking that Richard's negatively thinking about him, replacing and challenging those ideas. Intervention. I believe that this would be really beneficial in treating Richard's substance use disorder. And then EMDR therapy to address any triggers or negative responses for Sergio. The suggested evaluation plan is going to be very similar to a lot of people's evaluation plans. I think the important aspects in the assessment are going to be obviously the likelihood of if the client is going to harm himself or others, in which case we would maybe need some more severe crisis intervention. I think that an anxiety and depression assessment would be beneficial in this area. I also believe that identifying information, so basically helping Sergio and Richard to process their intersectional relationship. I also believe that they're evaluating their environment, so making sure that their home is clean and safe, and that they're being allotted the necessary resources. I want to also look into why they're seeking services, so get their perspective of what they're seeking, and look on their perspective for their treatment plan. I also want to look at their medical history. So physical and mental health, if they've been hospitalized before, if they have been seeking counseling or anything like that. Finally, the termination of treatment would be also similar to anybody else's. The discharge for Sergio and Richard could be possible when they are able to challenge and replace false perceptions of the other one's feelings. I also believe termination of treatment could be possible when Richard is able to maintain his sobriety and to address his substance use issues. And I think that both could be discharged or terminated treatment when they're able to communicate healthily, and when they're both able to challenge and replace negative thoughts regarding each other. So that is going to be the end today.